Well, hello and welcome to all of our viewers from around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome to everyone joining us here today. I'm so excited. We're talking about our very special event that's coming up here at Gold Learning. And of course, it is our Gold Learning Tongue Tie Online Symposium 2022. That's right, folks. We are back here again. And I'm really excited to be bringing you such wonderful speakers internationally from around the world. They have so much to share with you, not only about this area of practice, but also really about what they do in their lives and why it is so important to them. So welcome to my very special guest here today, Dr. Camila Palma. It's so good to have you here. Thank you for joining me. I'm just so happy that you're going to be here with us. You have participated in our event before
Many years.
as a participant, and so you know firsthand, you've had the experience of enjoying the presentations, and now I feel so fortunate to have you with us. We've been working together a little bit on the presentation, and listening to you talk through some of the aspects of your presentation. Of course, I have the inside scoop here right now, but it's been really wonderful getting to know you through your lens. And it's been so special to me because you express so well, on the camera, but in your voice and your tone about the passion that you have for your families and the nuances that you have come to learn and understand. So I feel like you're very gifted, my friend. So I'm so excited to hear the full
No,
presentation.
I feel really honored because I've always been like an assistant, and now to participate as a talking, no,
Yes, as a speaker.
yes, I feel really honored to share with all the assistants, all the aspects, like from a pediatric dentist point of view,
Yes.
and also IBCLC. So that's
Oh,
two
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 things.
passions
Yes.
that I really enjoy.
Oh, that's wonderful. Yeah. So I wanted to express this right away so folks listening in can just catch on to some of that enthusiasm. And listen, we know we're going to talk about all sorts of things today because you and I think we align so nicely in just what's happening in the field of medicine when it comes to tongue tie, why these presentations are so important, and describe some of the things that are happening. But first of all, let's have you formally introduce yourself. You need to tell people where you are in the world and what it looks like for you. What do you do day to day? What is your practice like? So tell folks where you are.
So, I'm a pediatric dentist, and now I'm Peruvian, but I lived for many, many years in Spain, and came back for a few years ago with my family, Spanish family, to live in Lima, where I have my own private practice as a pediatric dentist. And I
Oh,
focus especially in the first years of life. So most of my patients are below 3 years old.
wow.
I'm very passionate about prevention and like the diet, mother, kid
Mm,
and child oral health. And yes, I believe very much in that dentistry is changing, and we're focusing more on prevention than actually treatment. So
right.
that's really good for me. And when I came back here, like already 6 years ago, I started studying because I've always been passionate about breastfeeding. So I started studying to become an IBCLC. So I had my residence in a hospital for a year. So
Mm,
because as dentists, we're not part of the medical, actually, the contact with mothers is not that easy for us. No, we have to
mm-hmm.
step out of the box of the office, of the dental office. So that's been a huge learning for me. And now I joined these two worlds that I'm passionate about.
Oh,
And I'm what I do actually is like a surgeon. I think there's not a day that I don't release a tongue tie, no? So but actually, I don't know, part of my talk is to try to focus in another point of view, like as a dentist, some
mm,
misdiagnose of that I receive. I get a lot of referrals from very different professions, and sometimes to release ties. And some of these patients do not have tongue tie. So I wanted to share with you
Ooh.
some of these cases when Ankyloglossia is misdiagnosed and with a receded chin, or no, with retrognathia and with a hypotonia, no. So, and that's what I'm going to share with you in my presentation, to
Oh,
just to make you maybe broaden a bit your understanding of another uh, situations that can lead to like a faux tie, right?
Sure, sure. Yeah, like the faux tie that we have talked about in the past. This topic is so near and dear to my heart. So, and the title of your presentation is Ankyloglossia Differential Diagnosis, Tongue Tie, Retrognathia, or Hypotonia. And of course, having a little bit of insight into the presentation, I can tell you that this line of, I guess, presentation or expertise, or really trying to figure out whether it is a tie or not a tie. And of course, you have the experience of having folks refer to you that it is a tie, and then you go back to them and say, actually, this is not a tie. So because the reason why it's so interesting is because there is a lot of dispute still, and I know that this will continue in this field of medicine, that tongue ties exist and tongue ties don't exist. And I think this is some of the problem that we are seeing, the misdiagnosis and the misinformation. And I believe that part of it is because we are continuing to learn and understand, what is happening. And so let me ask you this. I'm going to put you right in the hot seat right now. Tell me when you started to realize that there was this misdiagnosis happening and that people were just flooding you with so many people, and you went, whoa, 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 what is happening? Tell me when you started to go on this journey of understanding.
I think it's been some years now, because I've been releasing times as a pediatric dentist for maybe 10, 15 years.
Wow.
So that's a
Yeah,
long time.
it
I
is.
graduated like 20 years ago as a pediatric dentist. So I've been doing this for so long, but I got into breastfeeding around, really interested, like around 10 years ago. And as the evidence comes, because it's
Yeah.
as I was telling you, I've been an assistant to the tongue tie symposium for so long, no, and you hear from so many points of view and so many professions that you learn about, not to see it just like as a profession, no, that tongue tie is very much a functional, no, iteration. So as a dentist, I have been releasing ties just like by the aspect, but then as years go by and the evidence comes, then you realize it's actually you see more like the functional part of the tie,
Right.
and how this makes the mothers or the diet have problems with that. And I think it's just because of the experience of being a dentist that maybe you see things that other professions don't. So
Right.
I get referred some patients, I don't know, by a nurse or maybe a pediatrician, and I was like, oh, release this type because the mother is having these problems. But
Right.
then you see the tongue, and the tongue is it's just perfectly moving, but then it has something else. There are other
Right.
like oral problems, and that makes the difference, no? So maybe sharing a bit with the assistants some things they should actually also see and be aware of that could confuse, and that would actually lead to an over treatment, and that is not good for the patient, no, so
No.
for the diet even, and gets parents frustrated, because if it's not a real tie, you release it and the problems will still be there.
Right. Yeah. And I think this is something we hear a lot of. There's a lot of uncertainty. And I experience it, even in my practice, when I refer perhaps to a pediatrician or a midwife or whoever is available. And then of course we do have dentists alike, like yourself, who have more experience and they're invested in breastfeeding and other oral matters that that they see that other folks would never see. So it makes me so happy to hear you talk about it, and just you know, it's almost like a reaching back to say, listen, they're not all ties, because,
Yes.
you know, maybe sometimes we thought they were ties, but we're really taking it one step at a time, and we're being
Definitely.
careful and recognizing other conditions that, you know, that maybe we didn't talk about so much in the past, but we're getting educated, we're doing better. And that's,
Yes.
Camila, I just appreciate you so much. And I, again, you know, I'm looking forward to this presentation in particular, because it's very visual. This is the other thing. So for our folks listening in right now, for our participants, I want you to know it's a very visual, lots of videos, you know, lots of really good sort of looking at the jaw from a different, you know, angle, and the oral anatomy. So you're gonna love it. I know for sure. Everyone's gonna
Thank
love
you.
this. And so you're really in for a very special presentation. And thank you for joining us live. You're going to be
Thank you.
here with us live at the presentation.
Yes.
So we'll be able to sit with you and have a live Q&A. So if you are coming to this symposium live, make sure you come by Camila's presentation and join us in the chat. Share your experiences. We want to hear from you as well.
Yes.
And ask lots of questions, because this is our opportunity. We come together, you know, once a year at the Tongue Tie Symposium, and we get to sit with such wonderful presenters like yourself. So thank you again for
Thank
being
you very
part of
much,
this.
Fiona. Looking
Yeah, I really
forward to it.
appreciate it. Yes, yes. So let's just wrap things up here once again by reminding everyone the title of your presentation is Ankyloglossia, Differential Diagnosis, Tongue Tie, Retrognathia, or Hypotonia. And you're going to be live with us here on September 12th. And of course, remember, we've got 2 days of this symposium. I know you're going to participate as well, Camila, as a
Yes, I won't
participant.
miss
Yes,
any
you're going to
talk.
attend. Yes. So when you go to our website right now at goldlearning.com, you can log in and see all of the presentations right now. And if you're coming to join us, you want to be part of this symposium, it is 2 days, but you have choices as well. You can come for 1 day or both days. I know it's going to be difficult to choose though, so I hope that you can join us for both. And of course, you can come to the live presentations, but everything will be recorded for your convenience, and you can join us when it's convenient to you as well. Well, thank you so much to Dr. Camila Palmer for joining me
Thank you,
here
Fiona.
today. Thank you. And we will look forward to seeing you on those live days. And of course, to all of our folks listening in today, thank you once again. And we will see you online. Bye-bye for now, everyone.
Bye-bye.